Welcome, everybody. Welcome to episode 5 of PEM Rules, the Pediatric Emergency Medicine podcast. And today we will be finishing our discussion on the rules, the clinical care tips group, which is the first group. And we have a short episode. We're only going to be discussing 2 rules, 2 of my favorites, actually, and I know you've heard me say that before. Rule number 18, swollen equals broken. In my ER, probably because we are in Central Florida and the weather is fantastic most of the time, I see a lot of kids with musculoskeletal injuries, ranging from open fractures to buccal fractures and very mild injuries. And I always teach the residents it's very, very important when you see a child who had any sort of musculoskeletal trauma and is now swollen over that area, there is a fracture, and you can comfortably say to the mom, "Mom, I'm really sorry, but I think little Johnny has a broken bone." It is very simple. All of us are born with very strong ligaments and very porous bones, and as you grow up, that process kind of changes and our bones become very strong. Our ligaments and muscles, on the other hand, become weaker. So an adult can certainly sustain a sprain or a strain and they don't break bones very easily. That's also true for adolescents. But in kids, certainly in babies, a fracture is a lot more likely than a dislocation, simply because of what we just said. So if it is swollen, it is broken. When I see a 7-year-old with a foot injury and swelling, I tell the parent immediately that unfortunately there is a fracture. I'm simply getting an x-ray to see what kind of fracture there is and if there is any significant displacement, and I explain what that means. Now, I think it's also very important to understand that that rule is still relevant even if the x-ray is normal. Normal x-ray in a child with an open growth plate, unfortunately, still means a fracture. It is a Salter-Harris 1, which is why you can't see it. Salter-Harris 1 means the fracture is through the growth plate. Growth plate is black on x-ray, and the fracture is essentially invisible, but it's there. My personal experience is when I see a child that fell a day or 2 ago, the pain was bearable, mom thought it was a strain or a sprain and put him on an ACE-strap or something like that, and is now presenting to my ER because the pain has just been too much. Those kids often have a normal x-ray, meaning a Salter-Harris 1 or a buccal fracture. But remember, the fracture is still there. Certainly, these patients can be placed in a splint and see orthopedic in a day or 2. It's not necessarily a serious injury, and if no reduction is necessary, a splint is more than enough. Another interesting situation is when I see a young teenager post-trauma and swelling. When I evaluate the x-ray, if I see no fracture, but the child still has an open growth plate, I diagnose a Salter-Harris 1, I splint the child, and I make sure the parents are aware that follow-up with orthopedics is very important. If the growth plate is closed, I am comfortable with the diagnosis of a sprain or a strain. I may still put them in a splint or maybe even an ACE-strap, but I feel that follow-up with orthopedic is significantly less important. If the growth plate is closed and the x-ray is normal, it's truly normal. So what I do is I order an x-ray, I take a look at the growth plate, and if the growth plate is open and the child is swollen, I diagnose a Salter-Harris 1. If the growth plate is closed, the child is swollen, I'm comfortable with the diagnosis of a sprain or strain, ACE-strap, and follow up with the primary care. Rule number 19, kids don't just vomit. I think many of us, myself included, tend to maybe anchor on the diagnosis of gastroenteritis or maybe food poisoning when we hear the chief complaint of vomiting. But I often remind the residents that vomiting is not necessarily a GI problem, especially when the child has vomiting as a sole symptom. I think it's very important to keep in mind that, generally speaking, with gastroenteritis, especially after a few days, there really should be some other symptoms like diarrhea, maybe fever, maybe abdominal pain. If it's Coxsackie virus, maybe some upper respiratory symptoms, something. I'm always a little bit more worried and a little bit more hesitant to diagnose gastroenteritis when the kid has been vomiting and vomiting only, especially if it's been a few days. I often remind my residents and the medical students that vomiting can actually be a neurological problem, meaning increased ICP. I think those of us who practice pediatric emergency medicine long enough, unfortunately, had the opportunity to diagnose first time brain tumors in children, and those kids often present with vomiting alone. Their neurological exam may be even normal. So I think it's important to understand that vomiting, just vomiting, is not necessarily a GI problem. Another good example is vomiting, especially vomiting in fever, especially in a female infant. I find that the residents often anchor on gastroenteritis and forget that urinary tract infection, which is really pyelonephritis in newborns, can easily present with vomiting and fever. So remember rule number 19: kids don't just vomit. Vomiting alone has a long differential. So that is it for today, guys. Thanks for listening. Remember, short episode. Rule number 18: swollen equals broken. When you see a child who had a musculoskeletal trauma and is now swollen, you can feel comfortable telling mom there is a fracture. Rule number 19: kids don't just vomit. Vomiting alone has a long differential. That is it for today, guys. Thank you very much for listening, and I will see you next time. Have a great day.